You do not want to miss this 10 medical surgical nursing NCLEX questions. We're going to alternate between select all that apply and single answer questions, and I want you to answer each one before I reveal the correct response. Keep track of your score, but more importantly, pay attention to the clue in the question that leads you to the answer. Let's start. Question 1. A patient being treated for an acute asthma exacerbation reports worsening shortness of breath despite using the prescribed rescue inhaler. Which findings indicate that the patient is experiencing a severe exacerbation? Select all that apply. A. Oxygen saturation of 88%. B. Difficulty speaking in complete sentences. C. Mild expiratory wheezing after exercise. D. Chest retractions. E. Cyanosis around the lips. F. Peak expiratory flow at 85% of personal best. Pause and select your answers. The correct answers are A, B, D, and E. An oxygen saturation below 90%, difficulty speaking, chest retractions, and cyanosis indicate significant airway obstruction and impaired oxygenation. Mild exercise-related wheezing and a peak flow above 80% of personal best do not represent the same level of respiratory compromise. Your NCLEX clue is failure of the rescue inhaler plus signs of increasing respiratory distress. Question 2. A patient receiving mechanical ventilation suddenly develops severe dyspnea, hypotension, tachycardia, absent breath sounds on the right, and tracheal deviation toward the left. Which intervention should the nurse anticipate immediately? A. Chest physiotherapy. B. Needle decompression. C. Incentive spirometry. D. Three-sided occlusive dressing. Pause and choose one answer. The correct answer is B. Needle decompression. This patient has findings of a tension pneumothorax. Air is accumulating under pressure and shifting the mediastinal structures, which can rapidly impair venous return and cardiac output. A three-sided dressing is used for an open pneumothorax, while chest physiotherapy and incentive spirometry will not relieve the trapped intrapleural pressure. When you see hypotension, absent unilateral breath sounds, and tracheal deviation, think tension pneumothorax. Question 3. A patient arrives in the emergency department with possible acute myocardial infarction. Which findings support this suspicion? Select all that apply. A. Crushing substernal chest pressure. B. Diaphoresis with pallor. C. Pain radiating to the jaw or left arm. D. Chest discomfort consistently relieved by rest within 3 minutes. E. Shortness of breath with nausea. F. Pain that occurs only during exercise and is predictable. Pause here. The correct answers are A, B, C, and E. Myocardial infarction may produce crushing chest pressure, radiation to the arm or jaw, diaphoresis, pallor, dyspnea, nausea, or even upper abdominal discomfort. Predictable symptoms that occur with exertion and resolve quickly with rest are more consistent with stable angina rather than an acute myocardial infarction. The important distinction is that an MI represents ongoing myocardial ischemia and injury, not predictable exertional discomfort. Next question. A patient receiving an IV antibiotic suddenly develops generalized itching, wheezing, facial swelling, and a blood pressure of 76/42. Which medication should the nurse expect to administer first? A. Diphenhydramine B, methylprednisolone, C. Epinephrine, D. Albuterol. Pause and choose your answer. The correct answer is C. Epinephrine. This patient is developing anaphylaxis with airway involvement and shock. Epinephrine is the first-line medication because it addresses bronchoconstriction, airway edema, and severe vasodilation. Antihistamines, corticosteroids, and bronchodilators may also be used, but they do not replace epinephrine as the immediate treatment. When NCLEX gives you allergen exposure plus airway compromise and hypotension, think epinephrine. Question 5. A patient is being evaluated for inflammatory bowel disease. Which findings are more consistent with ulcerative colitis than Crohn's disease? Select all that apply. A. Continuous inflammation of the colon. B. Frequent bloody diarrhea with mucus C. Right lower quadrant. Abdominal pain D. Inflammation limited primarily to the inner intestinal lining E. Fistula formation between bowel structures F. Urgency and frequent need to defecate. Pause and select your answers. The correct answers are A, B, D, and F. Ulcerative colitis affects the colon and rectum in a continuous pattern and commonly causes urgency, frequent bloody diarrhea, mucus, and superficial mucosal ulceration. Right lower quadrant involvement, transmural inflammation, abscesses, fistulas, and skip lesions point more toward Crohn's disease. For NCLEX, remember, ulcerative colitis is continuous and superficial. Crohn's can occur anywhere and goes deeper. Question 6. An older adult with benign prostatic hyperplasia reports increasing suprapubic discomfort and has been unable to urinate for the past 8 hours. Which action should the nurse take first? A. Restrict oral fluids. B. Perform a bladder scan. C. Encourage the patient to ambulate. D. Administer the scheduled finasteride pause and choose your answer. The correct answer is B. Perform a bladder scan. BPH can obstruct urinary flow and lead to acute urinary retention and bladder distension. The nurse should first assess the degree of retention with a bladder scan and then anticipate catheterization if significant retention is confirmed. Finasteride works over time and will not correct an acute obstruction, while restricting fluids or simply ambulating does not address the immediate problem. The clue is unable to void plus suprapubic discomfort. Think urinary retention. Question 7. A patient with a gastrointestinal hemorrhage is developing hypovolemic shock. Which assessment findings should the nurse expect? Select all that apply. A. Tachycardia. B. Cool, clammy skin. C. Decreased urine output. D. Bounding peripheral pulses. E. Delayed capillary refill. F. Increasing confusion and agitation. Pause here. The correct answers are A, B, C, E, and F. Loss of circulating volume decreases tissue perfusion, so the body compensates with tachycardia, while peripheral vasoconstriction causes cool, clammy skin, delayed capillary refill, and weak pulses. Decreasing urine output and mental status changes are additional clues that the kidneys and brain are no longer receiving adequate perfusion. A bounding pulse does not fit the typical hypovolemic shock picture. For NCLEX, watch the organs. Brain, kidney, skin, and circulation will show you that perfusion is failing. Question 8. A patient hospitalized with sepsis develops increasing respiratory distress, bilateral crackles, and severe hypoxemia that does not improve despite supplemental oxygen. Which finding is most characteristic of acute respiratory distress syndrome? A. Hypercapnia that immediately resolves with coughing. B. Refractory hypoxemia. C. Unilateral absent breath sounds. D. bradycardia with hypertension. Pause and choose your answer. The correct answer is B, refractory hypoxemia. The hallmark of ARDS is hypoxemia that remains severe despite supplemental oxygen because fluid-filled damaged alveoli cannot perform normal gas exchange. Unilateral absent breath sounds suggest conditions such as pneumothorax, while the other findings do not describe the characteristic oxygenation failure seen in ARDS. If NCLEX says sepsis, worsening respiratory failure, and oxygen is not fixing the hypoxemia, think ARDS. Question 9. A patient with advanced liver cirrhosis is being assessed for complications of worsening liver dysfunction. Which findings are consistent with advanced disease? Select all that apply. A. Ascites. B. Jaundice. C. Dark urine. D. Increased tendency to bleed. E. Increasing confusion and altered behavior. F. Increased production of clotting factors. Pause and select your answers. The correct answers are A, B, C, D, and E. Advanced cirrhosis impairs the liver's ability to regulate fluid balance, process bilirubin, produce clotting factors, and clear toxins such as ammonia that can produce ascites, jaundice, dark urine, bleeding tendencies, and neurologic changes from hepatic encephalopathy. The liver does not increase clotting factor production as it fails. It loses the ability to synthesize them effectively. When mental status starts changing in a patient with cirrhosis, think about toxin accumulation and hepatic encephalopathy. Last question. A patient reports progressive loss of peripheral vision and describes the sensation as though the visual field is gradually closing in. Which disorder is most consistent with this finding? A. Cataract. B. Macular degeneration. C. Glaucoma. D. Retinal detachment. Pause and choose your final answer. The correct answer is C. Glaucoma. Glaucoma damages the optic nerve and classically produces progressive peripheral vision loss, sometimes described as tunnel vision. Cataracts cause cloudy or blurry vision, while macular degeneration primarily affects central vision. So remember the NCLEX distinction. Cataract cloudy lens. Glaucoma peripheral vision loss. Macular degeneration central vision loss. Let's see how you did. Question 1. Asthma asterisk A, B, D, and E. Question 2. Tension pneumothorax B, needle decompression. Question 3. Myocardial infarction A, B, C, and E. Question 4. Anaphylaxis C, epinephrine. Question 5. Ulcerative colitis A, B, D, and F. Question 6. BPH with urinary retention B, bladder scan. Question 7. Hypovolemic shock A, B, C, E, and F. Question 8. ARDSB, refractory hypoxemia. Question 9. Liver cirrhosis A, B, C, D, and E. And question 10. Glaucoma C. How many did you get right out of 10? But here's what I want you to pay attention to. Did you recognize the clue before looking at the answers? Severe asthma oxygenation and ability to speak, tension pneumothorax, absent breath sounds, hypotension, and tracheal deviation. MI ischemic symptoms that are not simply predictable stable angina. Anaphylaxis airway plus hypotension equals epinephrine. Ulcerative colitis continuous. Superficial colon involvement. BPH, think urinary obstruction and retention. Hypovolemic shock, look for loss of organ perfusion. ARDS, refractory hypoxemia. Cirrhosis, loss of normal liver functions. And glaucoma, peripheral vision loss. That is what makes NCLEX questions easier. Don't memorize the letter. Learn the clue that made the letter correct. If you got 8, 9, or 10 correct, put your score in the comments. And if you missed a few, tell me which topic you want me to cover in the next set. Subscribe for more NCLEX practice questions and rationales. You can pass this NCLEX. I got you.